Today, we're walking through a real clinical case to see exactly how doctors diagnose COPD. Let's get into it. So, a long-term smoker has a chronic cough. At what point does that actually become COPD? Let's find out. Okay, meet our patient. He's 70, a smoker for 45 years, and has that classic cough and breathlessness. The first step is a test called spirometry. It's all about measuring how well your lungs are actually working. Now, there are a few key terms here, but the one you really got to know is the FEV1/FVC ratio. All right, let's see his results. They gave him an inhaler first to open up his airways for the test. And here's the big number. His FEV1/FVC ratio is 0.5. So what does that actually mean? Okay, so the magic number for a COPD diagnosis is anything below 0.7. That is the official cutoff. And since his number is 0.5, which is way below that threshold, yep, it's a confirmed COPD diagnosis. But, getting the diagnosis is just step one. The next big question is, how severe is it? For that, we look at another number. His FEV1 is at 81% of what's expected for someone like him. And it turns out that 1% is exactly what NICE guidelines use to stage the severity of COPD. Check out, the guidelines lay it all out really clearly, from mild to very severe. It's pretty straightforward. So, with an FEV1 of 81%, he's actually in stage 1, mild COPD. Kind of surprising, right? This case is a perfect example of the standard process. So, what's the general playbook for doctors? Well, the NICE guidelines lay out a really clear path. This keeps the approach consistent for everyone. Spirometry is number one, but other tests like a chest x-ray help build a complete picture of a patient's health. So here's the final checklist: age, smoking, symptoms, and that magic ratio. Our guy met every single point. And that's how it works, from a patient's story to the numbers to a clear diagnosis and stage. So, the diagnosis is in. The big question now is, what comes next for him?